Hey, it's Dr. White, and we're back at the Dr. Whiteboard, and I thought we'd talk a little bit about macular degeneration. There is this huge group of our American population which is now getting into the age group where macular degeneration happens. The baby boomers are turning 65. There are 65 million baby boomers, and about 10% of them will get macular degeneration. 6.5 million people will get some kind of macular degeneration. Not a bad time to talk about it. So, let's do Macular Degeneration 101, and let's learn a little bit about the retina. The retina is actually a relatively complex sandwich of tissues. On the inner side, we have the choroid, and the choroid is basically a great big vein. That's where the blood vessels are underneath the retina. Next is the retinal pigmented epithelium. This is kind of like the guard fence of the retina. The RPE separates the inside of the eye from everything else in the body. It's kind of like the blood-brain barrier. There's actually a total separation from what's inside the eye from the rest of the body, and the RPE is the guard fence. Inside the RPE are the photoreceptors. Remember 4th grade science, 8th grade science, first time you learned about it? We have the rods, which are on the outside of our retina, kind of in the periphery, and then we have the cones, which are in the middle. The cones give us our sharp central vision. That's actually where color vision happens as well. And then on the very inside is the nerve fiber layer. The retina and the retinal fibers are actually part of the brain. And the nerve fiber goes to the brain from the retina. When I look inside the eye, when I look at someone's retina, I can see the optic nerve, the major blood vessels, and then here in the middle is the macula. Right smack in the middle of the macula is the fovea. This is where our sharpest central vision occurs. Any damage to the macula at any level will affect our central vision, the vision we use to read, watch television, recognize faces, things of that sort. In the macula, we have the highest concentration of cone photoreceptors, and when we get into the fovea, we have nothing but cones, and in fact, the nerve fiber layer does not cover the photoreceptors. That's why we get good sharp vision. Out here in the periphery, we have mostly rods. Those are most helpful for night vision, peripheral vision, things of that sort. So, macular degeneration is an aging change that happens in the macula, in the center of the retina, and when we come back, we'll talk about the different types and what we do for it. So, I'm the Dr. White. This is the Dr. Whiteboard. When we come back, I'll have my title there again too. I'll see you soon.